Live. Hello and welcome everyone to University of Washington's second University Dance Marathon second lecture series event. Thank you all so much for coming. A little introduction of myself. Once again, I am Zach Smith. I'm the executive director for Dance Marathon here at the University of Washington. And to give a brief background into our organization and our mission, Dance Marathon at UW is a registered student organization that brings students from various backgrounds and majors together to raise money and awareness for Seattle Children's Hospital. Students spend a year gaining leadership, teamwork, and nonprofit business experience while making an impact in the lives of sick and injured kids. The year culminates with a virtual celebration, virtual this year, where we meet patient families treated at Seattle Children's, play games, dance, enjoy entertainment, and at the end of the event, reveal our annual fundraising total. And a cool little tidbit about this, since 2016, Dance Marathon at the University of Washington has raised nearly $90,000 for Seattle Children's, which is absolutely amazing. In this year, Dance Marathon is hosting the Equity in Healthcare at Seattle Children's Lecture Series, which you are all attending right now. And these lecture series are mainly to help educate and share information on how Seattle Children's is addressing some of the most critical issues of health equity and access in our community. Today, we are very fortunate to hear from Dr. Sarah from the Seattle Children's Gender Clinic. Dr. Sequeira will be talking to us about access to health care for transgender youth. And next, we have representatives from the University of Washington's Greek Pride chapter who will be talking briefly about the community and resources available to LGBTQIA+ individuals on campus. So, to start us off, I would like to introduce Dr. Sequeira. Dr. Sequeira grew up in a small town just west of Houston, Texas, and moved to New Orleans to complete her undergraduate degree in biomedical engineering at Tulane University. And prior to returning to New Orleans for medical school, Dr. Sequeira taught high school math in Jacksonville, Florida with Teach for America. She then moved to Pittsburgh to complete her residency in pediatrics, fellowship in adolescent medicine, and master's in clinical research at the Children's Hospital of Pittsburgh. Dr. Sequeira is currently an acting assistant professor of pediatrics at Seattle Children's Hospital and co-director of the Seattle Children's Gender Clinic. And her research focuses on developing interventions to improve access to care for gender diverse youth. And real quick before we get started, we will have time at the end for a quick Q&A. So please, if you have any comments or questions, put them right into the chat, whether you're watching live from Facebook or YouTube. It'll all funnel to us, and we'll answer those at the end. So yeah, without further ado, Dr. Sequeira.
Yeah, thanks so much, Zach. So I'm really excited to be here today to talk a little bit with y'all about the work that we're doing in the clinic and in general some of the barriers that some of the young people that I take care of in the clinic face to accessing care. So as Zach said, my name is Gina Sequeira. I'm one of the adolescent medicine physicians at the Gender Clinic in Seattle and serve as one of the co-directors there. So I want to start this talk by talking a little bit about some of the health disparities that we know exist for trans youth. And I in general, don't like talking about the health disparities that the young people that I serve often face, but I do think it's a really important part of highlighting how important access to care is for this group of youth. And I don't like talking about it because I think it paints this picture of trans youth in a light that does not highlight the resilience and strength and creativity that exists in many of the young people that I take care of every day and truly have the pleasure of taking care of every day. Because I think it is critically important for us to understand that those health disparities do exist. I do think it's important for us to take a couple of minutes today to talk about those before we talk a little bit more about barriers to care and then conclude with talking a little bit about the services we provide in the Gender Clinic. So you can go ahead and go to the next slide, Zach. All right, so we know, just to give a little bit of context for how many young people who identify as trans exist in the US. We know there are roughly 15 million high school age youth in the US, and roughly, you can go to the next slide, roughly 2% of the young people, we think, likely this number is even more. Based on how you ask the question, you can get a little bit different percentages, but we think roughly 2% of young people identify as trans. And so that gives us roughly 300,000 high school age youth who identify as trans in the US. And so I think it's important for us to know of those, let's see, I don't know if you want to go to the next slide, Zach, maybe? Or I can just go off the cuff. So we know that
it looks like the slides hopped off for 1 minute.
Oh, that's okay, no worries. I can definitely, I can keep talking through, no worries. So we know there are roughly 300,000 trans youth that exist in the US, and this group of youth experiences some specific health disparities. And so those health disparities can be related to both violence and victimization that they experience in the school setting, in home, just in society, mental health disparities that exist. And I have some specific numbers here for you on this next slide. You want to skip to Zach? Yeah, perfect. So we know that young people who identify as trans, in comparison with their cisgender peers, are more likely to be bullied at school. You go to the next slide, are more likely to experience signs and symptoms of depression, are more likely to have experienced suicidality, and actually have, in fact, a 6.3 times higher prevalence of attempting suicide than their cisgender peers. They also are at higher risk of substance use and having kind of high-risk sex related to substance use. And finally, are much more likely than their peers to have experienced violence and victimization. And so this is a survey, or these are data from high school age trans youth, but I think really critically important to note that violence and victimization is not just isolated to high school, that we know many transgender people, but especially trans women of color, and especially Black and Latinx trans women, experience much higher rates of violence than other members of our community. It's like critically important to highlight that here. I'd like to take a second of this next slide to switch gears a little bit into what we know about broader populations of trans youth in the US. So this is actually a study that was done as a US, it's called the US Transgender Survey that was done in 2015. And I think what's important to recognize about this population, so this is a survey of adults who identify as trans, but it's actually asking them about when they started to recognize that their gender identity differed from the sex they were assigned at birth. And I think it's important to highlight in the context of this talk that the vast majority of young people are in an age range where I, as a pediatrician, would be caring for them when they recognize this about their gender identity. Now, whether or not they disclose that gender identity or felt comfortable or safe disclosing to other adults in their life at that point is another question. But I think what these data to me highlight is that we have an opportunity as pediatricians and adults in society, whether we're teachers or physicians or parents, we have opportunities to create welcoming environments and safe spaces for the young people in our lives to talk about their identity. And by doing so, there are some significant improvement that can happen with respect to their mental health. And so if you want to go to the next slide, Zach. So we know that the majority of young people in the US have access to a primary care provider, a pediatrician or family medicine physician that they're seeing for routine checkups during childhood. And so I think one of my goals as a physician and as a director of the gender clinic here is that I think we have a really incredible opportunity to partner with pediatric providers in the community to help support them and provide education for them and helping them feel more comfortable talking with young people about their identity early in life. They have these often have longstanding relationships with patients and with their providers in a way that I think can be incredibly helpful for young people to feel safe and affirming, and they have an affirming space in their pediatrician's office to start having conversations about their gender. And parents also have an opportunity to hear from a trusted provider the importance of affirming a young person's gender identity. If you go to the next slide, and then just one more, and you can actually go two more from there if you want. Perfect. Oh. Maybe not. There you go. Perfect. So what we know is that so important to know that pediatricians have, and many family medicine physicians, primary care doctors in general, have these really affirming, supportive relationships with many young people. I think there is still room for growth in them creating environments that feel safe for young people to disclose their gender identity when they're ready to do so. And I think it's really important as we think about those health disparities that exist that I spoke to first, that we know that we do have data also that suggests that if the more affirming environments a young person has in their life, so be that at home, at school, in their medical, in their medical home, the more environments they have that are affirming of their identity, the more environments that they are referred to using their name and pronouns, the better their mental health. We also know emerging data is continuing to suggest that access to gender affirming medications like puberty blockers and gender affirming hormones also improve the mental health and quality of life of young people who have the ability to access that care, and that comprehensive both medical and surgical services for young people who desire them as a part of their transition also is protective for mental health. And so by creating environments that are affirming, by promoting access to gender affirming medical care and overall comprehensive care for young people, we have an opportunity to make a move on some of the health disparities that I discussed in the first couple of slides. If you want to go to the next slide, and then one more. Perfect. So I want to take a step back and talk a little bit about specifically some of the barriers that many of the young people that I take care of experience in accessing care. And so I'll give an example of a patient. This is not their name. I have changed that for this talk, but just to give an example of a patient that I have seen recently. So I was taking care of a young person who was assigned male at birth, but identified as female and used she, her pronouns. And she grew up in a small town 3.5 hours from Seattle. And I think clearly recognized her identity, but wasn't sure how to be able to access care, and specifically access puberty blockers as she began to start to notice changes happening to her body that she felt really uncomfortable with. And so, in order for her to access care, the things that would need to happen are, first, she would need to talk with an adult in her life that is affirming. So there needs to be an adult in her life that creates an affirming, supportive environment for her to feel comfortable talking about her identity with that adult. And eventually, given she lives 3.5 hours to the closest gender clinic in our state, her family would need to potentially take off time from work, have access to a vehicle that would allow her to drive to Seattle 3.5 hours each way, to have a visit in our clinic. And so I think her story highlights the many of the barriers that exist, both on the individual level with respect to kind of her peer and family environment. And I'd like to talk too, as we move forward with this, about some other kind of structural related barriers that exist for a young person, especially a young person living in a rural community, to be able to access care and gender affirming care specifically. And so for this patient, if you go to the next slide, Zach, to be able to access care, there are many, if you go to the next slide, there are many things in between. So it feels like there's a huge canyon between this patient and kind of coming into my clinic to see me and having me prescribe puberty blockers for her. And so if you go to the next slide, so just to highlight some of these barriers, so there are many individual level barriers that exist for young people in coming to terms with their own identity, feeling like they have a safe space to talk about their identity with a trusted adult in their life. There are additional complications when it comes to accessing and consenting for care that exist for adolescents that don't exist for adults around parental consent specifically. And obviously financial, not only the financial kind of component of driving to 3.5 hours to come see us in clinic, but also other kind of financial barriers that exist, like the incredibly expensive cost of some of the medications, especially the puberty blocking medications that we use. And in addition to those individual barriers, if you go to the next slide, There are also some relationship or kind of peer level variables or family level variables that exist that can contribute to delays in accessing care. So, for example, many of the young people that I take care of have come out to their families, and their families are really struggling with accepting and affirming their identities. And so, for young people who that is their experience, and that is their parents' experience, often there are delays in care related to that, while their family finds is on their journey of kind of accepting their young person's gender identity. And then, in addition to those relationship kind of level barriers, we see community level barriers at the level of school, which, speaking to the health disparities data that I started the talk with, the experiences of violence and victimization, and the degree to which that contributes to some of the mental health disparities young people experience. And then there are also, I think, really critically important intrinsic healthcare barriers that exist related to the few number of gender affirming pediatric providers that exist. So specifically, kind of in our state, there are only a few pediatric providers who are comfortable prescribing gender affirming medications for youth. And so I think this just highlights the need for us to as a health system, really reflect and do better, and do a better job supporting and partnering with pediatricians, which I'll speak to a little bit later. I think one thing that's also incredibly important to note is that even in their young age, many of the young people that I take care of have had themselves already negative healthcare experiences. So, having come out to a provider previously and had a negative reaction, or been misgendered in the context of a healthcare visit. And so I think these experiences that I hear frequently from my patients just highlight, I think, the continued need for us to do better, not just as providers, but as whole health systems, to create environments that are more affirming and inclusive and welcoming for the young people, for trans young people. And then, in addition to these community barriers, there are some larger kind of societal or structural level barriers at the level of the health system, especially as it relates to insurance. So there are quite a few barriers related to insurance denials for these medications, and lack of legal protections to ensure that insurance does cover gender affirming medications for young people, especially because of the high cost of some of the medications that we use, specifically the puberty blockers. Without insurance coverage, the majority of families are unable to afford the to pay out of pocket for these puberty blocking medications. And so I think those additional kind of structural barriers at the level of insurance and the health system, I think, are incredibly important for us to advocate for change, and advocate for more inclusive policy with respect to health system policy and insurance policy. If you go to the next slide. So all of these barriers obviously very clearly contribute to some of those health disparities that we spoke to at the beginning of the session. I think one of my goals, Zach, if you go to the next slide, one of my goals as a physician, and one of my goals as a researcher, and as one of the directors of our gender clinic here, is to do everything that we can to build a bridge across that canyon, to create ways for us as healthcare providers to improve the access that our patients and families have to being able to get care, to figure out how we can help patients better overcome some of the barriers that they experience. And I'll speak to some of those in our next slide. So I want to make sure that I take a little bit of time to talk a little bit about the services we provide at the gender clinic. So I think, as many of you, I'm sure, know, that it is often really difficult to find community resources and support that are inclusive. And I think we find many of the patients and families that I see in the clinic, I find, are really struggling to connect with other parents or other young people, or struggling with finding a mental health provider that they know is gender affirming or knowledgeable about gender, and going to be kind of a welcoming provider for that young person. And so I think a huge part of our role in the clinic, so in addition to talking about medication, a huge part of our role in the clinic is to get young people and families connected with resources and support, not just in Seattle, but within their own communities, to partner them with parents in both in their region, and in Seattle, to connect with other parents to help if I have a parent who's really struggling with how to affirm their identity and to affirm their young person's identity, to be able to get them connected with another parent in the community to help kind of them understand and kind of normalize that experience and understand and have some support and realize how incredibly important parental support is in affirming a young person and improving their mental health. So we also provide some healthcare navigation services within our clinic. We have two incredible social workers that help our patients make sure that they're able to navigate the healthcare system and support their families and them in doing so. And then kind of more of my role is prescribing gender affirming medications, getting young people who need it connected with mental health support around their gender, and in a gender affirming therapist. And we also provide quite a few referrals to gender affirming surgical intervention for the young people we take care of. I think some of the pieces that I spoke to before about the barriers that many of the kids that I take care of experience, I think have really motivated me personally, and I think our clinic to better partner with primary care providers in the community to help them feel more comfortable opening the door for young people to have conversations about their identity when they're ready to. But also to figure out how we can work on expanding access to care. And I think with COVID, telehealth or telemedicine specifically, so doing virtual visits with young people is something that we have been doing a ton more now than we were before. We were using it in kind of really limited capacity prior to COVID, but now are seeing hundreds of patients via telemedicine since COVID started. And so I think I am really hopeful that continuing to expand and continuing to make sure that gender affirming care that we provide is available via telemedicine moving forward is really a critical component of ensuring some of those barriers related to travel and cost of travel and geographic kind of barriers that exist for young people to access care. That we can overcome some of those through telehealth. And so I am really excited to see how our services are able to continue to expand to youth across the region through the use of telehealth and by developing stronger partnerships and providing better support for primary care physicians in the community. So I'm looking forward to any additional questions y'all have after this.
Awesome. Thank you so much, Dr. providing that insight kind of into the work of Seattle Children's Gender Clinic, as well as the relationships and care that individuals are able to build and receive within that setting and environment. That's incredible. Thank you.
Sure.
I think it's also important to note the intersectionality, that is kind of the framework for understanding each aspect of a person's experience and identity when taking a look into the LGBTQIA+ community and the concept of gender identity as a whole. These aspects include gender, sex, race, class, sexuality, religion, etc. And looking more specifically into the social aspect of college, I would like to introduce to our next speaker, Greek Pride. To give a brief background, Greek Pride is a collective of LGBTQ+ members of the Greek system at the University of Washington. They aim to provide a safe space for queer individuals and educate all who participate in Greek life at the university. So without further ado, I welcome to you all Danny Levin, the Executive Council Coordinator, and Ronnie, the External Community Outreach for Greek Pride at UW.
Hello, everyone. Yes, thank you so much, Dr. Sakura, for that amazing presentation, so knowledgeable, and I'm so happy that we were able to join in and participate in this event. So, Zach.
Yeah, thank you so much for this opportunity. Oh, sorry, Danny.
Ronnie.
Thank you so much for this opportunity.
Is anything going on? Oh, can you see the slides? Hold on. Oh, there we go. There we go.
Okay, can you go to the first one?
Yeah.
Perfect. Okay, so to follow up, Dr. Sakura, we have a little presentation on just inclusivity, bias, and useful terminology, just because we thought with the theme of trans youth, it would be really impactful just to, share what we have in our knowledge book and see if it makes a difference for you guys too. So next slide.
Yeah, and then our discussion points today are a little bit more about Greek Pride UW, some useful terminology, a bit about implicit bias, and contemporary use. Next slide, please.
Perfect. So a little bit about Greek Pride at the UW. So one thing we do and have as a staple is our advocacy. So we really strive to make Greek life at the University of Washington more inclusive, just because our community in particular is one that is very heteronormative and has a lot of stigmas around it. And there are and is a LGBTQ community within it. So we want to make sure that that part of our community is heard as well. Along with peer education, we do more seminars like this. Ronnie's job is actually to set up these presentations, so she's a rock star. And then also our goal is to make the community more knowledgeable about the LGBTQ issues outside and in our community. And then as well as providing information and knowledge to Greek life, we also just strive to create a bigger sense of community for the LGBTQ people in our club. Really, it just is on the historically exclusive kind of nature of our organizations, and really to support a community that is accepting and welcoming for all. Yeah, next slide.
Yeah, and then some useful terminology that Danny and I came up with for our presentation is bias and what it means to be biased against a certain group of people, and then what it means to be an ally as well, and how to be there for people even if you can't necessarily relate to them. And then gender and how, you know, you're not always the gender you are assigned at birth, and then discrimination, which goes hand in hand with bias and being an ally, and then the LGBTQ plus community. Yeah, next slide.
So we wanted to focus, especially when we're talking about trans youth, on implicit bias. That includes like what assumptions are being made, how are they problematic, how can we change? And I think Dr. Sakura had a lot of great tips in her presentation about just what really is going on within healthcare with trans youth and how we can combat that. So some solutions just against general implicit bias that we had put down are just focusing on seeing people as individuals, rather than what they are or what you think they are, of course. And then work on consciously changing your stereotypes. And that also is like a community thing. Like we have to combat it together, or else the stereotypes are just going to live on. We can also work on adjusting our perspectives, increasing our exposures to certain groups we might have biases against, and then understanding and respecting the magnitude of unconscious bias as well. So really, what we have predispositioned, especially against like trans youth, we need to make sure that we are there for them. We have their back. We have the community for them, which is one of the main reasons we're doing this presentation, right? Next slide.
Yeah, and then some contemporary news that we have is that nearly 1 out of 5 LGBTQ plus characters on American TV are tied to the same 4 industry creatives. So most of the characters that are part of the LGBTQ plus community they just come from 4 people within Hollywood. 4 people as in like the writers and directors and producers mainly. And then advocates in Utah are proposing a controversial proposal that will impact the health of transgender youth. And in Kansas, lawmakers are considering measures to bar transgender youth from girls' sports. Yeah. And then next slide. And then
yeah. So
that's
pretty much it. Thank you so much for letting us hop on this amazing event and present a little bit of knowledge for you guys. I think it went really well with Dr. Sakura's presentation. So thank you.
Awesome. Thank you guys so much, Danny and Rel, for giving us a look into your organization and Greek Pride and ways in which it's creating, as well as UW, a more inclusive environment, especially around some more historically exclusive organizations. Yeah, thank you so much. And again, put in any questions that you may be having from either Danny and Renel's slides or Dr. Sakura's as we move forward. And I think especially when talking about access to healthcare for transgender youth, it's also important to discuss the disparities that can be found in access to social clubs and organizations for not only transgender youth, but also the LGBTQIA plus community as a whole. So again, thank you so much, Danny and Renel in Greek Pride. That is all the presenters that we have for this lecture series event, but hopefully there were meaningful takeaways for you all watching. I'd like to give one more big thanks to Dr. Sakura and Greek Pride for their involvement and willingness to share their wisdom and understanding of gender identity and the LGBTQIA plus community. So thank you all one more time. And now we have some time for questions. So if you have not already, like I said before, feel free to write in any questions you may have using the chat feature on either Facebook Live or YouTube Live, wherever you're streaming. Or if you know me and you have my number, just text some questions to me as well. Either way, whatever works. And we'll just get those running. So we actually have a few coming in. Let's see. First one is gender affirming care now a standard topic in medical schools? If not, how can we help advocate for this change?
Yeah, so that's a great question. So is it a required part of the curriculum? I think it varies quite a bit, medical school to medical school. I think I found, now I'm going to be very clear about dating myself here, back when I was in medical school many years ago, it was something that I felt was really a void in the medical school kind of education that I received. And so as a part of that, I tried to contribute to that education for my peers and make sure that we had the opportunity to receive training, and so sought out lectures in my community to be able to come in and deliver content to my peers and my peer medical students. There is some data, so I haven't seen more recent data to this degree, but back in 2010, there was a study that was done out of Stanford that looked at, in general, it surveyed medical school deans, and it looked at about 175 medical schools, and it asked them, how many hours do you kind of do LGBT related content? So this is all LGBT related content, not just trans care. And the mean amount of hours that was that the medical students or the medical school deans suggested was that 5 hours in the entire kind of 4 years of medical school is what was required, right? So this is back in 2010. I am not aware that there's any more recent studies that kind of compare to what that looks like now, but just, I think that highlights the degree to which there are many providers in practice right now who never received this education formally as a part of their training. And doesn't say that they're not interested, but I think we kind of as a healthcare system have not done a very good job providing that education. And I think that's something that I'm really excited to be able to be a part of in my current role and in partnership with Seattle Children's.
Thank you so much for that response. That's awesome. Another question that has come in, and also you guys can all chime in if you ever think of an answer to the response as well. It's not like one or the other. So another question is, how can one be an effective ally?
I can go ahead and answer that just because I feel like it's more general too. I feel like really what it means to be an ally is, especially for those who are like cisgendered and, comfortable in their own skin that they were born in, don't have any kind of thing going on in terms of relating to the LGBTQ plus community. I really feel like being an effective ally just means supporting those who are in the community and showing that you do understand that. Well, okay, I phrase it as, you can't understand what they're going through, but you can understand that you can't understand. So really showing hey, you matter, no matter what, I just see you as this, you are what, to me, it couldn't be any different.
Definitely. Awesome. Any other thoughts before we move on to another question?
Yeah, I think, in kind of building off what Danny said, I think a really important part of being a good ally is, your self-awareness of privileges that you might have that someone part of the LGBTQIA plus community might not have, and then maybe listening to them, and also being an ally could also lead to, helping in the fight for equality.
Yeah.
Definitely. Awesome. Thank you. Our next question is specifically for Dr. Sequeira. How can individuals support gender clinics in our area and increase access to healthcare for transgender youth?
Yeah, so that's a great question. And I think, these two incredible Greek Pride members, I think, are perfect examples of this. So I think I'm really excited to have established this connection with y'all and be able to talk about ways that we can kind of directly support one another in the work that we're doing and partnering more together. I think more broadly, for people outside of Greek Pride, members of the community, I think one thing that's really important is your role as an advocate in advocating for safe, affirming, healthy, welcoming spaces for the young people that I take care of, and that's being an advocate in schools, for example, to help support gender and sexuality alliances in schools, or kind of volunteering your time in that space to create welcoming environments that way in your own environment. I think there also was mention of some of the legislative bills that have kind of been brought to, unfortunately, been brought to attention in many states over the last year, especially. So more than 20 states, not just the couple that were mentioned, have brought legislation into their houses or senates that in some cases actually would make it impossible for me, or would fine me or penalize me as a medical provider for providing this care to youth. Some have discriminated against youth who identify as trans in sports, but some have been targeted at trying to decrease the amount of gender affirming care that we can provide. And so I think one thing I would say to members of the community is to really be vocal as an advocate, vocal in politics, and really ensuring that we are electing people into public office who share the same values of equality, and ensuring access to this care that we know is going to improve the mental health and quality of life of the young people that I take care of.
Awesome. Thank you. We actually have another question for you, Dr. Sequeira. How can parents help their children regarding gender identity?
Yeah, so this is huge. So I think there's tons of ways. I think first is recognizing and letting your child lead, right? So sitting down and being present with them and listening to them about what they're saying to you, right? So like as they come out, creating an environment, one that is starting conversations with them about their gender identity and normalizing that at a young age, I think helps young people feel like this is a space where I can be myself. And I think, if you are a parent of a trans child, I think creating an environment at home and doing everything you can to advocate for affirming environments for them at school and in healthcare and every other part of their life, I think we have data to suggest that in and of itself, so using their name and pronouns and helping advocate for all of the spaces that they exist in, do the same, that improves mental health and quality of life for young people. And so I think those are the kinds of things that I often sit down with parents and have really, really honest conversations about. Like I know a lot of parents, it's a transition for them to kind of wrap their head around ensuring that, the young person, like getting to a place where they're able to affirm the young person in their life. And I think sometimes need some support in doing that. And I think that's something that I'm hopeful in the clinic we are building additional capacity to do, to connect parents with other parents, to help them feel like they are not alone in this experience, that they have other safe spaces and other safe adults to talk with about some of the challenges that come along with just parenting an adolescent in general, but especially parenting a trans adolescent. But I think a parent's role is incredibly powerful in creating safe and welcoming environments for young people. And so I think it is an incredibly important part of caring for youth, and is also caring for their parents and ensuring that they feel supported and affirmed in that journey as well.
Absolutely. Yeah, thank you. This next question is for you, Ronnie, and Danny. Any advice for educating a family member / friend who still holds onto negative stereotypes?
Ronnie, do you want to go first? Do you have anything?
Yeah, this is kind of something I've struggled with my own family, and educating them on how they see things and how their argument for its tradition and it's how they've seen things, and how I tell them, well, the world has changed and the world's more progressive now and you need to keep an open mind. Big thing was listening. This was, at least for my family, from personal experience, was listening to why they have these negative stereotypes and why they have them and where it comes from them. And then like slowly opening up the conversation, because this is a really long conversation and it's not something you can change overnight with someone. Obviously that would be nice, but it's something that takes time for people to accept and to let go of their negative stereotypes. So listening and patience is really important.
Definitely. And then just to add on to that, like I was literally going to say, you shouldn't go into it expecting it to be fast because it is a process, like Ronnie said. I remember in one of the discussions we had as a club, it was really, really insightful to learn about how many people do unfortunately go through the process of coming out as whatever they are, and ended up getting such a negative response from their families that like some of them even got kicked out, you know? So it's really, really rough, especially if you are a member of the LGBTQIA community. But it just takes time. So just know that and keep at it. Be consistent, but don't like think that it's going to happen overnight.
Definitely. Thank you for that. Let's see. We have one more question in the chat, and I have a few more on the side. But this one is for you, Danny and Ronnie, once again. And also, Dr. Squared, you can chime in afterward. How has the public's opinion regarding gender identity changed over the past decade?
Yeah, definitely. I would definitely say like I feel Dr. Sakura would have probably a better, like more healthcare related answer. But I'll say just from like a perspective of Ronnie and I, just because we're youngins, right? Like I feel grateful that we were able to grow up in a culture that is being more progressive and being more accepting, especially because like growing up, I was very fortunate enough to have LGBTQ family members. So coming out was like nothing. Like it felt super easy. But I realize now that that's not how it is for basically like 80% or more, right? Like a lot of them have bad experiences. So I feel like the way that we've been accepting it more has really just been about exposure and how much we've been able to see as a society and how much we've been willing to put out as a society. And even like in our slides, we had a thing that was like all out of all of the shows that have LGBTQ plus like what is it, characters in it, only 4 writers write all of them. So it's still a very like niche thing where people are like, oh, we see so much of it, but really it's only being produced by a couple people. So it's going to take more time, but I feel like it's just been exposure that's been really driving it.
Yeah, I think there's been a huge increase in healthcare. So in terms of healthcare access, we went from really like in 2007 having the first kind of big multidisciplinary gender clinic in the US to now having 50 plus pediatric gender centers across the country. So I think this last decade has been an incredible one in terms of kind of our ability to provide care to trans youth in a way that, do I think we still have a whole lot of room for growth? Absolutely. But I think it's been a pretty exponential increase in access to gender clinics, at least for kids, which is really exciting.
So good.
Yeah, that's awesome. Sweet. Okay, another question for you, Dr. Sequeira. How can the transgender youth community positively impact healthcare?
Oh, wow. So I think in massive ways. So one thing I was talking to y'all a little bit before we started about is that we're establishing, or in the process of establishing, a youth advisory board for our clinic. And one thing that I'm incredibly excited about with this group is that truly the youth that we have on this advisory board are going to be helping us inform the changes that we're making in the clinic, right? So as we're thinking about making a change to the way we're providing education about starting hormones or something like that, we have a group of youth that are able to help us make the decisions about what feel like the right way to do that from a youth perspective. And so I think youth using their voice to say like, hey, this is working for me in healthcare or this isn't, I think to the degree to which they're comfortable is an awesome way for them to be able to change the way healthcare, really the structure of our healthcare system works, right? So patients being really vocal when things aren't going well, that's what helps me change the way the clinic is structured, right? When I hear from patients and families like, hey, it took us this many phone calls to reach a person to get an answer to our question, that helps me as the provider and the kind of director of the gender clinic say, hey, hold on, we need to take a step back. Why is this so complicated? How can we streamline this process so that patients are able to get access to answers or questions, or get access to medication sooner? I think it is important, though, to note that it should not ever be the responsibility of the trans community to make those changes. That I think it is on really us as a society, more broadly, to be able to utilize the privilege that we have to be able to make inclusive spaces for young people without them having to kind of carry that burden.
Definitely. Awesome. Thank you.
Amazing.
Yeah, another one right off the back, again to you, Dr. Sequeira. This one's a little bit longer. Person-affirming, culturally sensitive, and trauma-informed language is so important in healthcare. What steps can we take to change our language and reduce bias, prejudice, and discrimination in healthcare?
Oh my gosh, yes. So I think I agree with the person who asked this question that we do have a whole lot of room for improvement. I think, for many years throughout my medical training, have heard from countless patients about things that have not been working in the healthcare system, or experiences that they've had that have made the healthcare system not feel like a welcoming place for them. And sometimes those are related to kind of LGBTQ identities, and sometimes they aren't. Sometimes they're related to race or ethnicity or disability or so many other aspects of someone's identity. And I think that it is incredibly important that we as providers and kind of leaders within the health system say, we need to hear from patients what's going well and what's not. And so I guess this kind of aligns with my last response in a way that I think that we have got to recognize that patients should be at the forefront of making decisions about how we're changing and improving and adapting the healthcare system to be a more inclusive and welcoming environment. And if we aren't creating spaces for patients to have a seat at the table to make decisions about the type of care that they're receiving, or the kinds of education their providers are receiving, then we're not doing them justice, right? And I think there's a lot that we could be doing better as a health system to make sure that patients and families' voices are at the forefront of the work that we're doing. And I'm really excited that there is, I think, a lot of motivation on a part of the health system to do better. But I think there is a lot of room for improvement. I couldn't agree more.
Definitely. Thank you for that. We actually have one more question. And again, right back to you, Dr. Sequeira.
Okay.
This one says, wonderful presentations. That's an all-around thing. Please talk about some strategies for increasing the competency and knowledge of healthcare practitioners working with transgender youth.
Yeah, this is a great question. So this is right up my alley. It's like one of the things that I'm most excited about, actually. So I think a part of our kind of mission as a clinic, and I think this is something that we are very actively seeking out right now, is trying to understand from pediatric providers in the community how we can better support them, right? So how would they prefer to receive that support? And so we're in the process of reaching out to pediatric providers to hear from them how we can do better as a clinic to make kind of our resources and our knowledge better shared across into community. But I think some of the ideas that I have about how this could actually look are a couple-fold. So there are some teleeducation platforms. So basically it's a platform that connects kind of a subspecialty clinic like ours with a cohort of pediatricians or primary care providers in the community to provide education and consultation on a regular basis about a certain kind of topic. And so this has been done a lot in the adult world, but not so much for youth. And so I think we are in the process of our clinic of developing a model like this to partner more effectively and provide education and consultation for providers. We're also thinking about how to adapt, so to use the electronic health record to our advantage and be able to exchange information between us and pediatricians or family medicine doctors in the community that are taking care of youth, to create really streamlined ways for them to ask us questions or seek out resources about how to support trans youth that they're taking care of. Without having to find a way to call us or get a patient referred, like actually be able to do this work in their primary care clinics. Because I think by doing that, you're like over time, they're going to be able to create more welcoming and affirming spaces, not just for that patient, but for other patients as well. So super excited about both of those things that we are kind of actively in development right now. Both the like kind of electronic consultation platform in our electronic health record and the teleeducation and consultation platform. So stay tuned, check back in like next year, and I'll fill you in on kind of where we're at on that.
Definitely. Awesome. Oh my gosh. Okay. One more question just popped in. These are just like flying. I think this should be our last question as we continue on. Again, Dr. Sequeira, this one's for you. What does federal funding look like for gender clinics that improve support for physicians? Do you expect an increase with new administration?
So that's a great question. So the federal funding for gender clinics is not a thing. We are funded from the hospital. There's not a thing. I am hopeful though. I think that this new administration, that there may be opportunities for us to kind of establish some funding infrastructure through them. I think we've been very lucky as a clinic to have some local foundations supporting us as well, but really have heavily relied on that because we haven't, because there are no kind of federal funding streams available. But I am hopeful that kind of with advocacy and with time, as this becomes, as it's recognized that there's such a need for this work, that there may be opportunities, especially in the context of the administration change, that is a part of our future, but it is unfortunately not right now.
Good to know. Awesome. Thank you so much. I think that was our last question. Let me just make sure. They're coming in a little bit late. Okay. Yes, that was our last question. Thank you so much, Dr. Sequeira, Danny, Ronnie. Thank you so much for your presentations and your amazing responses to all the questions that came in. That was incredible. And before we close out, I just want to kind of reemphasize that this lecture series event has been hosted by Dance Marathon at the University of Washington. And one more time, DM at UW is a registered student body organization that brings students from various backgrounds and majors together to raise money and awareness for Seattle Children's Hospital. With that being said, we would absolutely love your support in helping kids who may otherwise be unable to afford the care that they need. And one way that you can do this is by registering for our event, which will be held on July 16th, 2021. It'll actually be a 26.2 hour event, which should be really cool. And by registering, you will create your own personal fundraising page, which is going to pop up very shortly. And here you can put in your own proceeds, all of which go towards Seattle Children's. Or you can encourage family, friends, coworkers, classmates, clubs, etc. To give toward your fundraising page. And another cool component when registering is that you can create a team fundraising page. So this is kind of where your friends, family, coworkers, etc. can all be part of the same fundraising page, giving you all a chance to kind of make a fun and friendly competition around fundraising if you'd like, or you can collectively challenge yourselves to see how much you can fundraise. So that's definitely something super cool about this. And so as you can see, here's our donor drive, and the link should be in the chat to go and register for this event. And it's also in our Instagram handle, our Instagram bio, sorry. And our Instagram handle is DM at UW, which is literally DMATUW. So go check that out for sure. And one other thing that I would like to kind of shout out is Seattle University at, sorry, let me start over. Dance Marathon at Seattle University. We are so grateful that we will actually be collaborating on our final event with them this year. And so go check out their Instagram handle as well, which has more information into their Dance Marathon program. And that event, again, will be April 16th to 17th. And their handle is Seattle U Dance Marathon, which is Seattle and then the letter U Dance Marathon. So that's awesome. Other than that, I think that's all that we have for you today. We have another lecture series coming up next month, so stay tuned for that. And also stay tuned, sorry, I have so many updates coming in my head all at once, for a fundraising event with Greek Pride and Seattle Children's Gender Clinic that should be coming up soon, just to keep the momentum that we've built here. So one more time, thank you all so much. And I'm going to close it out. Have an amazing, amazing day.